Minimal invasive surgery. What is this? Nowadays, we are hearing this person underwent lap chole, that person undergone appendectomy, lap appendectomy, or is this possible to perform this surgery through keyhole? The patients are asking. It became so normal, so common that every medical student should know this and every surgeon should practice it. If you are a medical student, please go through it, and even if you are a common man and if you are interested in learning something about minimal invasive surgery, please go through these slides. This is interesting. The National Medical Council gives the following syllabus to be followed for the MBBS students. Describe indications, advantages and disadvantages of minimally invasive general surgery. Shall we see how a laparoscopic surgery is performed? So the patient is kept on the operating table. The anesthesiologist, he gives general anesthesia for most of the laparoscopic surgeries. But some laparoscopic surgeries can also be performed by spinal anesthesia also. What are the examples? Appendicitis, cholecystectomy. These are some of the examples. After giving anesthesia, the surgeon makes a small incision, usually at the level of the umbilicus, patient's umbilicus over here. So after giving incision, he passes a small needle known as orice needle, through which he injects carbon dioxide gas. After inflating the abdominal cavity, peritoneal cavity with carbon dioxide, he passes the camera. So this is the camera. Once he passes the camera, he can visualize the interior of the abdomen through the monitor. Then, depending upon the necessity, he passes a few more instruments through small holes. This is the laparoscopy setup. Let us understand the endocrine and metabolic changes in laparoscopic surgery. For any injury, the body responds with endocrine and metabolic changes. Surgery is also a trauma. When surgery occurs, the hypothalamic pituitary axis as well as the sympathetic nervous system, they activate through the efferent nerve inputs. Where do these efferent nerve inputs come from? From the trauma site, that is surgery site. Normally there is feedback to control the hormone secretions. When injury occurs, this normal feedback mechanism for controlling the hormones like corticosteroid, adrenaline, all those things, they fail. What does this minimally invasive technique does? It reduces the inflammatory component of the stress response. Mind you, it can only reduce the inflammatory component of the stress response, but it does have very little effect on the neuroendocrine and metabolic responses. Since it has reduced the inflammatory component of the stress response, minimally invasive surgery is associated with reduced pain and short hospital stays. compared to the open technique. What are the areas where minimally invasive surgery is practiced? The first one is laparoscopy. This is used for abdominal surgeries. Then there is thoracoscopy, where the chest conditions can be addressed. Then arthroscopy, as the name implies, perform surgeries inside the joints like repair of the anterior cruciate ligament injury, meniscal injuries, etc. Then there is NOTES. NOTES stands for natural orifice transluminal endoscopic surgery. Then endoscopic procedures. In laparoscopy and thoracoscopy, arthroscopy, we use rigid tubes, whereas in endoscopy, we send the instruments through flexible tubes and flexible instruments. Then there is bariatric surgery for weight reduction. Then MIPH, that stands for minimally invasive procedure for hemorrhoids. These are some of the surgeries that extensively uses minimal invasive surgery techniques. Minimal invasive surgery practiced for abdominal conditions is known as laparoscopy. So what are the different types of laparoscopic surgeries that are performed? One is laparoscopic cholecystectomy. When there are symptomatic gallstones in the patient's body, then you have to remove that gallbladder. Or in case of acute cholecystitis also, we remove the gallbladder. This is laparoscopic cholecystectomy. This is one of the most common indication and the gold standard treatment for cholecystitis as well as cholelithiasis. Then the second operation that is performed usually is for appendicitis. For inflamed appendix removal, we do the laparoscopic appendectomy. Another operation that is being performed by majority of the surgeons is hernia repair. Then different surgeries like colectomy, where we remove part of the colon for inflammatory bowel disease, diverticulitis or colorectal cancer. For those conditions, we remove part of the colon, we say it is colectomy, laparoscopic colectomy. Then when acid regurgitates into the esophagus from the stomach, known as gastroesophageal reflux disease, GERD. Then we also do Nissen's fundoplication. Nowadays, for weight reduction, even movie stars also, they are undergoing bariatric surgeries. Hysterectomy is one of the commonest laparoscopic surgery that is performed by the gynecologists. Myomectomy also is one of the common indication. Adrenalectomy, splenectomy, and all traditional surgeries are being conducted nowadays through laparoscopy, depending upon the skilled surgeon availability as well as the infrastructure. Let us see bariatric surgeries. These are weight reduction surgeries. As you are aware, Anant Ambani, Junior NTR, and many rich people as well as movie stars, they undergone these bariatric surgeries. They are weight reduction surgeries. So they are performed to help people with severe obesity to lose weight. This is achieved by either reducing the stomach size or bypassing the portion of the digestive tract. We will see the first bariatric surgery, that is gastric bypass surgery. In gastric bypass surgery, the surgeon creates a small pouch at the top of the stomach and it connects directly to the intestine. So this limits the amount of food that can you eat, as well as it reduces the absorption of the nutrients and calories. Then we will go on to the next type of bariatric surgery. Second type of bariatric surgery is sleeve gastrectomy. Here, a large portion of the stomach is removed and only a smaller sleeve-shaped stomach is left behind. It restricts the amount of food that a person can eat, and also the ghrelin secretion, the hunger hormone secretion, is also reduced. Now we will move on to the third type of bariatric surgery. Another type of bariatric surgery is adjustable gastric band. What is it? It's a band placed around the upper part of the stomach. It creates a small stomach pouch and a narrow passage. This band can be adjusted by inflating or deflating the band. So if the patient loses rapid weight loss, you can adjust it to allow more food. Likewise. Next we will move on to the ultimate bariatric surgery. The fourth type of bariatric surgery is biliary pancreatic diversion. Biliopancreatic diversion with duodenal switch, otherwise known as BPD/DS. This is a type of gastric bypass. Here, this is a more complex procedure. A large portion of the stomach is removed and the food is rerouted through small intestine. A large portion of the small intestine is excluded from the normal digestive process. These surgeries, they are performed when the BMI, that is body mass index, is more than 40. What is body mass index? It is a ratio between height and weight. If body mass index is more than 40, or in some cases even if the body mass index is only 35 and they have other conditions like type 2 diabetes mellitus or blood pressure, high blood pressure, then also this surgery is advised. It is to be kept in mind that this is more complex procedure, and post-operatively also the patients need dietary modifications and they need regular exercises. If these things are not adhered to, this may give rise to lot of complications. Another type of minimal access surgery is robotic surgery. Robotic surgery, the name is misnomer because robots won't do the surgery. It is the surgeon does the surgery. In Devancy robotic surgery system, so there is a console here, and in front of the console the surgeon sits, and his hand movements are transmitted to a system in the operating room. So this is the patient. Into the patient the ports are driven, and the surgeon can see whatever there is in the abdominal cavity, and his hand movements are very precisely are transmitted into the machine and into the abdominal cavity. This system is even more superior than minimal laparoscopic surgery, but it is more expensive also. Almost all surgeries being done, initially it was introduced for performing the urological surgery like prostatectomy. Minimal access surgery is also practiced for thoracoscopy. Lung biopsy, lung resection, pleural biopsy, pleurodialysis. So these are some of the indications for thoracoscopy. This is also used for decortication. Decortication is a procedure to treat or recurrent pleural effusions by creating adhesions between the two layers of pleura. It helps in preventing the fluid buildup. Then decortication of the lung, that is removal of the fibrous tissue that forms over the surface of the lung due to conditions such as emphysema or fibrothorax. Then thoracoscopy is also practiced for thymectomy, mediastinal tumor resections, sympathectomies. Then this is also useful for esophageal surgeries such as esophageal myotomy for achalasia or minimal invasive esophagectomy for esophageal cancer. So these are some of the indications for thoracoscopy. Different arthroscopies also utilize the advantages of minimal access surgery. For example, in knee arthroscopy, meniscectomy can be done, meniscal repair also can be done, anterior cruciate ligament reconstruction can be done, as well as posterior cruciate ligament reconstruction. Cartilaginous repair can also be done. In case of shoulder arthroscopy, rotator cuff repair can be done, labral repair, shoulder decompression, or repair of the superior labrum anterior to posterior, that is slap tear, can also be done. In case of hip arthroscopy, again labral repair or femoroacetabular impingement surgery, synovectomy can be done. In case of ankle arthroscopy, ankle ligament repair can be done. Then debridement of ankle impingement, that is removal of excess of bone or soft tissue causing the impingement in the ankle joint, such as anterior impingement syndrome or posterior impingement syndrome. SILS stands for single incision laparoscopic surgery. Here there is only single incision. It is a specialized form of minimally invasive surgery. The entire surgical procedure is done through a single incision. Usually the single incision is placed at the level of umbilicus. Here the instruments are flexible, they are not rigid. You can see they can bend. The primary advantage of sills is that it further minimizes the surgical trauma. Why? Because the incision number is less. When the surgical trauma is less, the postoperative pain is also less, there is faster recovery time, and there is improved cosmetic results. And the scars are also less visible. Appendectomy, cholecystectomies, hernia repairs, and various other abdominal surgeries can also be performed by sills. This is significant advancement in minimal access surgery, and it is continued to getting evolved. And there are innovations in the instrumentations as well as surgical approaches. Notes. It stands for natural orifice transluminal endoscopy surgery. Here the access is through either mouth or anus or through vagina. So NOTE stands for natural orifice transluminal endoscopic surgery. It's very novel technique. It's also a minimal invasive surgical technique. The aim is to reduce the minimal invasiveness further. A flexible endoscope is inserted through these natural orifices, and they are navigated through the body's internal passages to reach the target organ. Then, once the endoscope reaches the desired location, the surgical instruments passed through the endoscope, and necessary interventions and procedures like tissue removal, organ repair, or biopsy are performed. Now you understood the advantages of the minimal access surgery. It causes reduced pain. Smaller incisions lead to less postoperative pain, a faster recovery, shorter hospital stays, and quicker return to normal activities. Minimal scarring. Cosmetically appealing results will be there. Less blood loss compared to the open surgery. Then there is low risk of infection. Then there is improved precision, especially in robotic assisted procedures. Of course, there are a few disadvantages and risks for minimally invasive surgery also. What are they? Steep learning curve. The surgeons need special training to develop eye-hand coordination and familiarization with insufflators, the different surgical instruments, etc. Visualization is 5 times magnified in case of laparoscopy, but there are some areas they are not as visible as in open surgery. Not all patients are fit for laparoscopic surgery. Example, the lung conditions. Then there is always possibility of conversion to open surgery. Most of the surgeons, they say that conversion to open surgery is not a complication of minimal access surgery. Then there are potential complications for any surgery like infection, bleeding, and organ injury. And it's not possible to handle those situations. We have to convert quickly into the open surgery. For example, there is injury to the bile duct or injury to the hepatic vein, etc. So we have learned the benefits and disadvantages of minimal access surgery. The benefits are smaller incisions, quicker recovery, reduced risk of infections, improved cosmetic results, decreased blood loss. And the challenges are steep learning curve, equipment cost, limited tactile feedback, risk of complications, and lastly, the patient selection. I think we learned the minimal access surgery very well. Let us see how much we learned by filling this form. This form can be accessed by the link given in the description or scanning the QR code. Enter your nickname so that to mask your identity, and for roll number you can give your roll number in the class or give a random number and fill the form, and once you completed the quiz you will get immediate feedback. It's funny, it is confidential, so go through it, take the challenge and enjoy it. The most common laparoscopic surgeries done are laparoscopic appendectomy and laparoscopic cholecystectomy. I recorded these surgeries 10 years ago when I was working in King George Hospital, Visakhapatnam. Those surgeries can be accessed by searching Bhavani Rao laparoscopic appendectomy or Bhavani Rao laparoscopic cholecystectomy. I also included those links in the description. You can go through them to get complete idea. Thank you all for the patient hearing and give me feedback.